Welcome to the show. In this episode, we'll be talking about something that's arisen recently in terms of public health, which is very important as the winter comes to an end shortly. And it's the case of measles, which is one of the world's most contagious viruses. Here's what to know and how to avoid it. Now, usually, most Americans, especially when you go to school or you come to the U.S. as an immigrant, you are asked to take the MMR vaccine. And that stands for measles, mumps, and rubella. So while measles is rarely seen in the United States, but Americans are growing more concerned about the preventable virus as cases continue to rise in rural West Texas. This week, an unvaccinated child died in the West Texas outbreak, which involves more than 120 cases. The U.S. Centers for Disease Control, the CDC, and Prevention said the last confirmed measles death in the United States was in 2015, 10 years ago. There are also 9 measles cases in eastern New Mexico, but the State of Health Department said there is no direct connection to the outbreak in Texas. Here's what to know about the measles and how to protect yourself. So first of all, let's look at what measles actually is. It's a respiratory disease caused by one of the world's most contagious viruses. The virus is airborne and spreads easily when an infected person breathes, sneezes, or coughs. It most commonly affects kids. On average, one infected person may infect about another 15 or other people, said Scott Weaver, a Center of Excellence Director for the Global Virus Network, which is an international coalition. There's only a few viruses that even come close to that. Measles first infects the respiratory tract, then spreads throughout the body, causing a high fever, runny nose, cough, red, watery eyes, and a rash. The rash generally appears 3 to 5 days after the first symptoms, beginning as flat red spots on the face, and then spreading downward to the neck, trunk, arms, legs, and feet. When the rash appears, the fever may spike over 104 degrees Fahrenheit, according to the CDC. So there's no specific treatment for measles. So doctors generally try to alleviate symptoms, prevent complications, and keep patients comfortable. People who have had measles once can't get it again, health officials say. So that's the body's own immune system and immunity coming to work. Can measles be fatal? It usually doesn't kill people, but it can. Common complications include ear infections and diarrhea. But about 1 in 5 unvaccinated Americans who get measles are hospitalized, the CDC said. Pregnant women who haven't gotten the vaccine may give birth prematurely or have a low birth weight baby. Among children with measles, about 1 in every 20 develops pneumonia, the CDC said, and about 1 in every 1,000 suffers swelling of the brain called encephalitis, which can lead to convulsions, deafness, or intellectual disability. It's deadly in a little less than 1% of cases, mainly in children, said Weaver, who works at the University of Texas Medical Branch in Galveston. Children develop the most severe illness. The cause of death in these kinds of cases is usually pneumonia and complications from pneumonia. So, how can we prevent measles? The best way to avoid measles is to get the measles, mumps, and rubella MMR vaccine. The first shot is recommended for children between 12 and 15 months old, and the second between 4 and 6 years old. Before a vaccine was developed in the 1960s, everybody got measles, Weaver said. But then, when the vaccine came along, that was a complete game changer, and one of the most successful vaccines in the history of medicine. There is great data on the safety and effectiveness of the vaccine, he said, because it's been around for decades. Any of these outbreaks we're seeing can easily be prevented by increasing the rate of vaccination in the community, he said. So if we can maintain, let's say, 95% of people vaccinated, we're not going to see this happening in the future. And we've slipped well below that level in many parts of the country. Vaccination rates have declined nationwide since the COVID-19 pandemic, and most states are below the 95% vaccination threshold for kindergartners, the level needed to protect communities against measles outbreaks. So, do you need a booster if you got the MMR vaccine a while ago? Healthcare professionals are sometimes tested for antibodies to measles and given boosters if necessary, Weaver said, even if they've already had the standard 2 doses as a child. He said people at high risk for infection who got the shots many years ago may also want to consider getting a booster if they live in an area with an outbreak. Those may include family members living with somebody who has measles, or those especially vulnerable to respiratory diseases because of underlying medical conditions. But he says that, but I don't think everyone needs to go and run out to their doctor right now if they did not receive 2 doses as a child. He said, if people would just get the standard vaccination, none of this would be happening. So make sure to check with your parents if you had the MMR vaccine as a child. Vaccination has also become sort of a political topic since COVID-19, where a lot of people don't want to take a vaccine as they're not sure of the long-term effects. But in reality, vaccines save lives. So, go out there and make sure that you've had your MMR vaccine. Avoid getting measles. It could be fatal. That brings us to the end of this episode. Make sure you subscribe to the channel. Give us a thumbs up and like if you are enjoying the content. Head over to buymeacoffee.com/SamsonKing. And as always, thanks for stopping by, and we'll see you next time.